And hi, everyone. TJ Alt, I-45 now, Pod now, and 288 now. I'm glad to have you on with us here today. Dr. Philip Keiser, as we like to do. We try to make it every couple of weeks. I took a vacation during the last time we were supposed to do a show. It's been a few weeks since we got around to this. Good to see you again, Dr. Keiser. How are things going?
Going well. Good to see you, TJ.
In the world of health, while I was away, some big news had popped up. Particularly with COVID-19. But let me first get into how are our COVID-19 numbers now looking within Galveston County, which you had the purview over?
Yeah, so we continue to see the numbers increase, just like we did every other summer for the last 3 summers. The numbers are not nearly as high as they were, say, for example, last year, but we also have reason to believe that people are getting tests and they're not reporting them because, people have home tests. And so if you get a positive test, go to our website and report it. That helps us keep track of what the numbers are. Don't worry, we're not going to come knock on your door or take you away, but it does just help us out. So we would appreciate that. But when we look at that, what we're seeing is that our numbers are increasing and they continue to increase. But the important difference is that unlike years past, now that we have vaccines and now that we have a lot of therapeutics that we can give people, we're not seeing nearly as many people in the hospital. And even when they do get in the hospital, they're not staying very long. They're not staying for weeks on end. They're staying for a few days and are for the most part being able to go home. We haven't had a death in several weeks. And if you look at, say, since March, we've had enough deaths you can literally count them on one hand. And so things have been going very, very well from that aspect. So I think we're really in that next phase that we've been talking about for a long time. And so overall, we would encourage people, particularly if you're at risk for having a bad outcome, be careful. But the other thing that we would tell people is that if you do feel sick or if you have a positive test, call your doctor because there's medicine out there that you can take that'll keep you from getting really sick.
Obviously, that one of those medicines is Paxlovid. That's out there. But for the longest time, we always say, well, where are we going to get to the point that that when we do have these discussions that we're at a point of where this is just manageable? Are we there yet at this point?
Maybe.
And I'm talking maybe on a national level, but also here local level.
Yeah. I mean, I think the answer is a definite maybe. It's hard to know because we never know what's going to happen, and we're not done with it. We've seen the virus continue to mutate, and now we talked about Omicron in the beginning of the year. We're on Omicron 4. It's still an Omicron virus, but it's different. And this Omicron 4 and Omicron 5, which we're beginning to see circulate, is even more infectious than the Omicron virus was, but it's not making people as sick. And so what does that mean and what does that bode for the future? It's really hard to say at this point. I can say that, compared to where we were last year this time or even the year before in 2020, we're much better off.
And the biggest part of that which was the whole focus on the health. It was to keep folks out of the hospital.
Right.
And that was the first priority.
Yep.
And the extra was for those that could result in a death. To keep those healthy. And that's the big, I guess, if anything, victory here. I don't know if that's too strong of a word or not, but that the victory is. And I wonder, too, is that one of the things I know we have been doing in these discussions, not so much focusing on what folks may see on the screen there saying active cases so much. Because we don't track, during a pandemic, yes, you track it that way. But it gets into how many folks are in the hospital, how many folks are severely ill. That's what we've been trying to pay more attention to, in our when we do this show, and that is where it's at a level that's not overwhelming a healthcare system and the like. Correct?
That's correct. I mean, if you go right there where you are and go down and pull up to current hospitalizations, I don't know what the number is today. I know the number yesterday was about 13 people. Okay, and with 2,600 people that we know of. Okay, so now it's actually increased. But when you look at the total number of people that are infected, that number is relatively low compared to where it was 2 years ago or even a year ago. So we're in this transition period, And I think that the key is that we would encourage people who haven't gotten their boosters to get their booster. I know a lot of people are trying to time it. Should I get it now? Should I wait? I'm going to go on this trip. I'm going to do this. No, just go ahead and get it. Get your booster. If you're at high risk, or if you're at a certain age like me and you're eligible for a fourth booster, get your fourth booster. Don't wait. Just go ahead and get it. The other thing that's being recommended is that, if you're indoors, particularly in large settings, wear a mask inside, particularly if you're worried you're going to have a bad outcome if you get sick. You should definitely be wearing a mask because there's a lot of COVID around right now. And then, the third thing is that if you feel sick, call your doctor. We can give you pills like Paxlovid. We can give you, and monoclonal antibody infusions, and all things to keep people well. And I think all of these things together, the vaccines, the medication, plus the virus mutating, has really changed the face of this illness.
And as I said, we added that set. We already have folks coming up who, obviously in the comment section saying all sorts, or we're promoting something. Folks, if you actually listen to the words we're telling you here, that we're not promoting anything except what we would promote in other times, which is to be healthy. Yes, if you're sick, stay home, go see your doctor, get treated. That's what we're telling folks here. And there's no hand wringing here.
No. I wish I got paid based on the number of vaccines we gave or the number of people we treat, but I don't. So.
Right. So one of the things I wanted to be able with talking about booster shots. I'm one of those who I actually asked you before I went on a recent trip of, hey, you think I should do a booster now or wait until then? And you advised me, so go ahead and just do it now. You don't need to wait until right before the trip or anything like that. But where are we now as far as making this as part of our regimen when it gets into, I'm going to keep calling booster shots, but I'll use myself as an example. My first COVID shot was in 2020.
Right.
Not 2020, 2021, I should say. I wish it was in 2020. Anyway, so that first shot was then. Are we at a point now that it's an annual booster? Where are we on the research on, just for general health, what we should be doing? When do we see something come down the pipe of, all right, every year, the recommendation is go get your COVID shot.
Yeah.
You do your shingles shot, your pneumonia shot, and your flu shot.
Yeah, I wouldn't be surprised if we actually see this every year. Right now, the big debate isn't, do we need a shot for these variants and also to boost people? The real question is, can we do it fast enough to keep up with the way the virus is mutating? So let me give you an example of what happens with influenza. Influenza, every year there's a flu shot, and that's based on this big surveillance system that's worldwide, where they can track how the influenza virus is changing and make sure that everybody gets the right vaccine. Some years they don't get it right, and some years they get it pretty good, and some years they hit a home run. But, for a flu vaccine, if you get it where it prevents 50% of the deaths and 50% of the hospitalizations, that's pretty good. With COVID, we've done much better than that. We were in the 90% range. So the real question is, what's that optimal point that you say, okay, this is the booster or this is the shot we're going to tell everybody to get next fall, right? So the science isn't there yet, and the surveillance systems aren't there yet, so that we can predict what is the best one you need. So there's a vaccine for the Omicron variant that's ready to go. And there's a lot of debate as well, should that be released or not? Because that Omicron variant that helps protect us against, that's not the one that's going around now. It's a variant of the Omicron variant. And so keeping up with it is really going to be the challenge. But I think once they figure that out, absolutely, I would be shocked if we were not all getting our COVID and influenza vaccine. And quite frankly, it wouldn't even surprise me at some point if we have one shot that has both our COVID and influenza vaccine together.
And that's what I was going to ask, because that was when I got the booster. I had that exact discussion with the person administrating the shot. It was like, hey, how long until we, because I said, I wish I could have my pneumonia or flu and this all at the same time. And we were having that whole conversation. I said one shot versus multiple and the like. Yeah. And again, this is for folks who want to have their own free choice if they want to do this or not. Yeah. But it gets into part of your healthcare regimen. If you want to go in and have this done. But it gets to the other point too, is money. because right now, if you go in for a COVID vaccine, that outside of the administrative fee that some places charge, your insurance isn't getting charged for that. The government is paying for that.
That's right.
That's going to be how much of this debate you think is that phase of, all right, we got to get the insurance companies all on board of paying for this, or we're going to have to find out who's paying out of pocket for what would be preventative care, which is what the flu shot is. Like my insurance pays for the flu shot when I go in. Where are we in getting to that standpoint as you understand it as well? Because that probably has to go hand in hand before the shots become a regular part of the vaccines, I should say, become a regular part of a health regimen.
Yeah, no, I think it's a very good point. And I think a lot of people are worried. The Biden administration had requested more money for COVID relief that would include extending vaccines and extending medication. And that got stalled in Congress for a variety of reasons, including that it was bundled with other things. And, I don't want to get into all the politics of it. But right now, that money's due to run out. And so when that happens, all of us are asking what's going to happen and how will that get picked up? And the answer is we don't know at this point.
So now we've got into, and I got this notice, and I jokingly told you before we came on the air, that already the health district was sending out the notice about the back to school vaccines and getting ready for back to school and everything else. And you and I got in this discussion about, it's almost the whole discussion of, when do you put Christmas lights up and everything else. I'm one of those, we both said, we're after Thanksgiving type people. And, but it gets into the whole, it's time to get vaccinated and thinking about that. But I go into in the back to school boosters, just to talk about this ahead of time. Given what we heard a lot from folks about the COVID-19 vaccine, versus this, and there was already kind of an anti-vaccine movement that was out there. But by the way, based on no facts whatsoever, they've been proven over and over and over again. I'm not talking about COVID-19. I'm talking about measles shots and everything else. Do you expect to see a resistance overall of parents bringing in their kiddos for what has been the norm on vaccines, and in many cases also required by law this point forward, given what we've seen in kind of this political fight the last couple of years?
Yeah, no, I actually do. And we're already beginning to see it in that parents are not avoiding. It's very rare for parents to avoid vaccines altogether. But what some parents are doing is they want to mix and match. They'll go, okay, I want my child to get this vaccine, but I don't want this one. It's okay to get that one, but I don't want that one. Oh, I don't want to get them to get all their vaccines all at once. I want to spread them out because they're worried about making them sick. And, there is that tension there, and it wouldn't surprise me if we see that continuing to grow with that as a backlash among some folks. What can I say other than that? These vaccine recommendations are actually very, very carefully considered. And if you don't believe it, maybe we should invite you to some meetings we have where we have pediatricians there. And I will tell you, they are rabid about the way they want to protect their kids. They don't want to protect they don't want to subject the children to any unnecessary pain or risk. And I've had my head bitten off more than once by a pediatrician because they didn't particularly like the way that they thought that we were going about things. So I think everybody is aware of that, and in the way the recommendations are come, they are very, very carefully considered. And if you have concerns, again, talk to your doctor, talk to your pediatrician, talk to your family practice doc, get your concerns answered. And I think for the most part, and this isn't for every kid every time, but for the most part, the vaccine recommendations are pretty good, and it's a good idea to follow them.
We should point out too that Texas Health and Human Services Department actually has a pretty good section on immunizations or schools. You go to it actually has the list of what is required. By the way, COVID-19 vaccine is not one of the required vaccines.
That's correct.
And by the way, it's not in there. A lot of folks think that it's become added and it's not been.
Right.
There are many on that are required for the school year to come in, and that's state law. There's no getting around it unless you have one of the mandated exceptions that have been around for a while. I just wonder if it gets into that kind of personal choice. Also, too, we'll have a back to school fair here coming up pretty soon.
Yeah.
With the health district that we participate with y'all every year, of getting folks not only back to school immunization, but also shots. I mean, books and book bags, stuff like that, I should say, that goes on along the way. And it's really reflective that you can, you get some, take advantage of. But most folks are going to go to the pediatricians. I wonder if you made a good point. Maybe we should bring on a pediatrician on with us. Maybe Matthew Hay, even from UTMB, would be a good one to bring on with us, who is not only a pediatrician, but also a school board member as well at the same time. So maybe a good one to have on with us. Speaking of kids and shots, the big news that came out, the government approved younger kids able to get the COVID-19 vaccine. You had pointed out before we went on the air, there's not been a mad rush for that. Not unexpected, by the way. But talk about that, the concerns that will be there. What's different between the COVID-19 vaccines that are offered out there for youngsters? Because now we're able to go, because the age range is now 2 and up. Is that correct? Or
Actually,
5?
6 months.
6 months and up. Sorry.
Yeah. It goes down for toddlers. And so, and it depends on the vaccines. There's 2 vaccines. One is Pfizer. The other is Moderna, the same 2 vaccines. The Pfizer shot requires 3 doses. The Moderna shot only requires 2. There are some people who feel like the Pfizer has more side effects. And so some of our pediatricians are really wanting us only to give the Moderna vaccine. But we were able to get the Pfizer first. And so we went ahead and stocked that, and we have that in stock, and the Moderna vaccine is coming as well. So again, if parents want to get it, it should be available in most pediatricians' office. It's available for at UTMB. It's available here at the health district. So if people have trouble getting it or can't afford getting it, they can come here and we can give it to them.
And as I understand what, like Pfizer, there's 3 shots, but each dose is a 1/10 of what the adult dose is.
Yeah, it's a much reduced dose, right. and they actually went with several different doses for Pfizer initially, and it took them a while to work out what the best dosing was. Part of the reason was that if you recall, there were some young men that were getting inflammation around their heart, what we call myocarditis and pericarditis, and so there was concern. Is that dose related? Number one. And then 2, what's the best dose to get a good response while not subjecting people to those rare side effects? And, because kids are much less likely to get really sick from COVID. So again, your risk benefit ratio is different. Your whole considerations are different. And but there is good reason to want to vaccinate the kids. We're seeing that with long COVID that it affects 20% of the people pretty much across the board. That the symptoms can range from just not feeling good to having smell and other disturbances to actually problems thinking and problems learning. And so that's one of the concerns that I think most of us has with regard to children. It isn't that we think all the little kids are going to get sick and die, all right? But we are concerned about the long-term effect of COVID and how that will affect them as they grow up. And the answer is that we just don't know at this point.
And of course, it'll be, sometime down the line that we'll see what we call the real world effects of these vaccines down there. And that's the concern a lot of folks have. And it's a genuine concern. I talked to many pediatricians who say it's a genuine concern. They can tell them all they want. It is different when you start talking about your kids than it is. Yeah.
That's right.
Someone say, like, okay, I'm going to go get it for myself as an adult just to be safe. But on the other end of it, I jokingly have said this, and you've heard me say this 1,000 times. I myself, having, I've gone through the 4 shot. I'd go in once a month if I had to, because I'm out and about and do it. And I'm not just talking about COVID. I'll do it for whether it's, the flu shot or anything else, even though I'm kind of bad sometimes on keeping that schedule on. So it's just, when I get sick, I really get sick and I go down for the punch. And so it's one of those things that it's one of those I want to avoid it. But and it gets into when we have this conversation too. What are things that folks can do? Because this was the part from day one of our first discussion about this. All right, what can folks do? Simple things in their life to prevent the spread of any of these communicable diseases.
Yeah, it's everything we learned in kindergarten, right? It's wash your hands. How much did we do that? And you know what was interesting is that early on in COVID, everybody was washing their hands, right? We were all washing our hands 20, 30 times a day. And then we were shocked that there wasn't a lot of flu and colds going around, Right. And so that's a huge one. Cover your mouth when you cough. Don't go out when you're sick and expose other people to illnesses. And, all these very just sort of basic hygiene and basic sort of polite society things, it's there for a reason. And it really does make difference. I think COVID taught us that very early on. Once, we all locked down, we all did this, what happened? Well, all of our respiratory diseases went away. Believe it or not, all our sexually transmitted diseases went away too. So these basic messages are important principles.
I wonder if that should be the thing. The message now is just to carry on it. I mean, yes, we can get old with that, but I just discussed this with you before I went on my trip. We took a cruise, and one of the things is the protocols on there are for check-in and stuff are pretty strict. I will point out to you so folks can learn from me. So it's how many hours before your disembarkation is what matters on your COVID test, not the days.
Right. Oh, I know. Right.
I was 3 hours off. I was 3 outside. I was 3 hours early on getting that because I based it on boarding time.
Yeah.
Not disembarkation time.
Yeah.
So I was 3 hours early, got there, and my stuff didn't match up. But here's the great thing, and this is why I like the system, isn't it? Went to the back, took a test, 20 minutes later, had my answers, and we're done.
Okay.
On board. Negative.
I was going to say you should have called us, TJ. We'd have sent somebody down to test you. And
no. I was ready because I talked to everybody. It was like I was ready for the line and said, I know Dr. Keiser, get him down here. I know he set up these protocols. But the one thing I will say this, it gave me an inside look of how that works. Right. It was really no big deal. Yeah, a little frustrating. But because I knew somewhat ahead of time, I was like, wait a second, it's flagging me already before I checked in.
That's right.
And I said, I just realized what the rule actually says is 72 hours, not 3 days, before. Yeah. And I said, oh man, I took it 3 hours early. And that's the only reason, that I popped for this. So we went down.
Same thing happened to my wife and I. We went down to Ecuador to go on a cruise, and we got our tests here at the health department. We had our official letters and everything and results, and they went, no, I'm sorry, it's 6 hours off. And they made us get tested again. So I got tested 3 times in 3 days in order to take my
quiz. To be able to do it. I go into that, the process though, very friendly staff there that's contracted. All of them who had pointed out there were some health district staff that work also for this company that were down there. Got to talk to them, but to see the process firsthand, very efficient. You go through it, do the quick test. You go sit in a room, wait, and they come back, and you get an email that says you're good, and then you get up and you're. And in many ways, we were 2 hours point a little bit faster than I would have been the other way, but outside of the 20-minute wait. But the other part of it is now I also noticed, there are hand washing stations every other few steps there. I took advantage of them everywhere I went. We didn't feel we needed to wear a mask, obviously, in the dining rooms or anything like that. And, we were pretty spread out, but we still kind of kept those protocols with, good, healthy managers. Came back, took a test when I got back, negative. Took another test a week later, negative again. Now, that's a protocol I make the decision to do because I know I'm going to be out and about among the public. So that's just that. And, I can schedule up a test at UTB, which is very easy as well, or the health district if we need to. But I think, that kind of told me, if anything, is, yeah, it's here. We still got to be concerned with something kind of goes sideways, but we're in that manageable stage now. I pointed out, talking with one of the cruise ship medical personnel, that, we hear about when these other viruses spread through a ship. And they're like, I said, have we heard of anything of any of these other viruses during this time?
No.
And that was the thing, just like you said about cold and flu during the initial parts of COVID. What we found is, if you follow those protocols, it works for that just as well. And we were hearing those headlines had gone away. So it's a long way of getting it is that there are some protocol procedures that may be part of life. That doesn't mean shutting down your life. Doesn't mean, going into lockdown or anything like that.
Yeah.
Those were early on. I know when we have the shows, we can see it in the comments. Folks are like, why are y'all still talking about this and getting sick of it? But I think if you actually listen to what we've been saying for a long time on the show is that we've always focused on what's next, not what we'll say there were mistakes made in the past. You particularly will say, we shouldn't have done it that way. In hindsight, we shouldn't have done it that way. But it was like, okay, how do you deal with what we're dealing with? And now going forward, we know that we don't need to go into a shutdown. And I go to that route because I'm going to bring up something here, and I'm going to caution to everyone right now. I'm not bringing this up because it's the next thing we got to get worried about. But let me just talk seriously, because it does make headlines and people see it. Monkeypox. We've got 3 cases in the city of Houston, 1 in Harris County, unincorporated part of Harris County, at this point that we know of. Any suspect cases in Galveston County?
We had one last week. It was an individual who had traveled to North Africa, and where there's a lot of monkeypox, and then into Spain, and then traveled through London and through Heathrow Airport, and there was a big shutdown in Heathrow Airport, and so everybody was packed in together, and came home, and then about 5-6 days later developed a rash that looked like it could have been monkeypox and had some ulcerations on the tongue. And so the ER that saw her called me up and said, "What should we do about it?" And I'm going, "Well, I'm 10 minutes away. I'm going to come down and see." And so I talked to this individual, and we actually scraped some of the lesions, and we were able to send it off for testing. And so the Galveston National Lab has an experimental test, and they were able to give me a result that day. And then we sent it off to the state, and the state gave me the result the next day. And both of those tests were negative. So this turned out not to be a case of monkeypox. But the reality is that monkeypox is, in places it's never been seen before. It's turning into a worldwide outbreak, I think, is probably the best word. Wouldn't call it an epidemic, wouldn't call it a pandemic. And it tends to be mostly among men who have sex with men who've had multiple partners in the past couple of weeks. But the CDC is starting to see it in women, and they're starting to see secondary cases, meaning that people have gotten it in the United States. We haven't seen that in Texas yet. It's not a sexually transmitted disease per se, but just from, the closest and the close skin contact. It seems to be more likely to be transmitted that way. But any type of intimate contact, hugging, kissing, it's been shown to transmit. And it causes a disease that kind of looks like chickenpox, kind of looks like smallpox. People feel very tired. That's the first symptoms people have. They feel fatigue for about 3-4 days. So if you're fatigued, don't think you have monkeypox. All right. So, and then they start getting the other symptoms, which can include a cough, but primarily a rash. And the rash can occur in a variety of places. And it usually starts off as little bumps, which then turn into blisters. And if you see something like that, really the thing to do is, go see your doctor. What we're trying to do right now, you're right, it's not the next biggest thing. We're not telling people run for the hills or we need to do lockdowns, but we do want the medical community to be aware of it so they can diagnose it, and so that we can do what we need to do to make sure that it doesn't get a foothold in this country and spread more widely so that it's here all the time. And that's our big concern with it. So far, nobody's died from it as far as we know. In the developed world, there have been some deaths in Africa, but none in the developed world.
And again, though, is that the general understanding of this is that is the spread of monkeypox is close contact, but there is been some evidence of some secondary contact that spread. Not enough to kind of say, okay, this is a serious concern, but in itself, but that there is, just to kind of keep an eye out, and the fact that anything nowadays, I think we're probably more sensitive to it now, obviously, with what we went through COVID.
That's right.
Off guard when the next thing comes.
No, that's
more a cautionary tale than anything else.
Right. That's right. And from the public health point of view, from what you see behind the scenes, that is really what we're worried about. We want to make sure that we have all the awareness in place, that we have all of the tools in place that we need to combat it should it show up in our county, but also if other people get exposed to it. For example, the thing to do is to vaccinate those people. Well, do we have vaccine? Well, the CDC has some. Well, where is it? Well, they don't have enough to give to everybody, but they've given some to Texas, and the state health department has some in Houston. So, it's really kind of working through all these issues that we learned the hard way in COVID that we need to talk about ahead of time and work out how we're going to communicate and respond once we do get cases, if we do get them, that we're worried about.
But those protocols are being looked at right now, correct? Just in case.
Yes, that's right. Yeah, we had a meeting on Monday with all of the local health authorities in the region, and that was hosted by the state health department. We've had discussions internally in Galveston. We've had discussions at UTMB. And so I think that we are getting ready to, we want to be ready. We don't want to be caught flat-footed. And the most important thing we don't want to do is we don't want to say, well, based on what we know about other coronaviruses, this isn't a concern, right? So based on what we know, we don't think so, but we also don't want to be so arrogant that we blow things off, or so alarmist that we overreact.
Goes into that the messaging that we learned from COVID probably.
Oh, absolutely,
is being played out here too. Probably a bigger concern for folks is what it comes around this time of year is sunburns and getting overheated, dehydrated, and of course mosquitoes as well. I just wanted you to get a chance to talk about skincare, how to protect yourself. What's the best recommendations?
Well, the best recommendations use sunscreen, and there are a lot of products out there, and they use the highest SPSF that you can get. And then the other thing is that if you're going to be out like at the beach or out boating or anything outside, also consider getting some SPSF clothing that you can use. That helps block the sun as well, and wear hats. Wear face coverings, and again, not to keep from getting COVID, but to just protect your face and keep getting dried out. Second thing is make sure that you're drinking enough water that you're peeing on a regular basis. I don't know any other way to say it without sounding crude, but that's really the key. If you're outside and you're sweating and you haven't gone to the bathroom in a while, you best drink something, or you're gonna get sick. And so those are, I think, the most important things. The other thing is that if you feel bad, go inside where it's cool. That's right. If you feel hot, if you're feeling overheated, don't keep pushing it. Don't gut it out. Oh, I usually run this far. I usually ride my bike this far. I usually do this. No, just go in and get some relief. That's, I think, are the key, the most important things for people to do.
How about mosquitoes right now? Obviously, they're annoying as all get out.
Right.
Seen anything Zika wise, West Nile or anything?
Yeah, not here. We have a surveillance program, and we actually have what are called sentinel chickens. So we trap mosquitoes, and then we have chickens that are out in these areas, and they get bitten, and then someone goes by and takes a blood sample and measures them. So there have been mosquitoes with West Nile up in Dallas, and that's always been a hotbed of West Nile disease. And I think there's been one or two samples that have been found in the greater Houston area, but we haven't found any in Galveston County. Again, the key is same thing. Use mosquito repellent. It actually works. Wear long sleeves, particularly if you're going to go, it's too hot.
Lost your audio there for a second, Philip. Can you hear us? hang on for a second. Philip, I think you hit a key that turned off your microphone. Can't unmute. Your mic got turned off there. Sorry first, folks. As he's trying to figure out something you hit there, Dr. Keiser, turned off your mic. While he's doing that, by the way, he was talking about SPF clothes. I would tell you about someone we work with. It's backhome.us. Actually, this is the folks who are going to be making our new SPF protection clothing, by the way. And you can see the difference. It's that internal there. And Dr. Keiser, let me see if we bring you on that. Got you on there twice. Let me see that. See if we hear you.
Yeah.
Now we got you
okay.
there. Something happened to you there.
I was on a roll, man.
You were. All right.
You missed it.
All right. Look, I saw you disturbed. So let me go back to the mosquitoes. You're talking about wearing long sleeve. Where you got cut off is wearing long sleeves. It may be too hot, and then you got cut off at that point.
So a lot of times people go outside in the evening, right? Because it's too hot to go outside during the day, and they want to wear, tank tops and other things. That's how you get bitten. And because as the sun starts to go down, that's prime mosquito time. Mm-hmm. And those mosquitoes are going to be coming after you. And so the best way to avoid them is to wear something long sleeve. It doesn't have to be heavy. It can be very light, something with a collar, and then cover your exposed areas with mosquito repellent. That's the best way to avoid the mosquitoes.
Yeah, and that's what I was kind of a double whammy here. A new partner of ours, backhome.us. They manufacture their U.S. made shirts here. I should point out, like I'm showing up one here that's U.S. design with the blue stripe for supported police, and it's the light wicking material.
Yep.
Here, as you see, I'll show off the logos. And these folks have become good friends of mine now. Mm-hmm. So they found out about them, and they're gonna be making some custom I-45 Now shirts. But here's the long sleeve. This is what I wear religiously when I'm out and about. And as I said, it's the SPF. This is an SPF 50 right there clothing. And you wear that. And they are very cool. They're great swim shirts, too. I should point out as well. So if you want to find out more about them, backhome.us, great patterns. Particularly if you want something, U.S. flag on it or Texas flag, any state you want. And then they're going to be making some custom I-45 Now shirts as well a little bit later in the year for us as well, that we're going to get out to some folks that go along the way. But yeah, it's the simple steps to protect yourself when you're out and about. And I've seen that too. You go out at night, and that's when the other night the mosquitoes just started coming out when on the back porch. And it's like, oh, got to spray the yard again, and get those out and to make sure that you're safe from that as well. It's all the things that want to get out here. So anyway, so that's how to keep yourself safe during the summer months from all the things. They're all simple. It's all available, easy to get. No one's telling you have to do it, but if you want to avoid getting really bit or itchy or sunburn and the like, those are the ways to do it. A reminder too, we mentioned the back to school block party that's going to be coming up. That the health district is going to be a part of. Right now they're taking donations to help out for those that need book items, and you can see Coastal Health and Wellness, the Coffee Connection, which is right next to the health district offices there, and the Texas Lamarck Chamber of Commerce are all kind of in that same area. Each day from 8 to 4 taking donations, and everything from box tissues, notebooks, plastic folders, and the like. And then also you can see that QR code. Be able to scan that there. If you scan that QR code, you can actually go to a school supply wish list on Amazon. I would encourage you before doing that, go shop local first, but that is available for you there. And if you need help to have your donation dropped off, you can call Brittany Rivers at 409-938-2270. And she can help you out. But it's the general stuff you expect them to need for back to school. And this is for all of Galveston County that the health district is working on this on. And then a little bit later, we're going to be having a pickup time as well as promoting, general good health for back to school and the like as well.
Yeah, we're also going to be offering school physicals. And remember, 2-a-days are coming. You don't like to say start too early, but for those guys that are going to play football, they're going to be middle July. They're going to start being out there.
Talk about being too hot.
Oh man. But last year when we did this, it really just kind of shows the sign of the times, and we expect even more. We ran out of stuff,
right,
and very early on, and we expect even more demand this year with the inflation, and we know that there are a lot of families out there that this could be really beneficial to. So please donate. It's going to go to a good place.
And if you need to find out more, you can go to the Galveston County Health District's website, and we also have a post up on I-45 now as well. Dr. Philip Keiser, he is the CEO of the Galveston County Health District and is the local health authority on with us as he does regularly. As we've told folks, yes, COVID-19 will still always be a topic, probably in some form, but as you see, we're talking about more other topics now as news warrants there. Philip, thanks for coming on with us. We appreciate it, and we'll talk to you again in a couple of weeks.
Okay. Thank you. It's always good to see you.
I'm TJ Alls with I-45 Now, Pod Now, and Galveston.